Hi, today we're going to talk about how you can manage and relieve your chronic lower back pain. I'm really excited today to have Dr. Mainiero from New Jersey on the call. Dr. Mainiero is a great doctor with a big heart, and he has decades of experiences and have specialized in helping patients with chronic lower back pain, and he has treated countless hard cases. So today he is going to share with us his deep insight and rich experiences and tips and advices on how to manage and relieve the lower back pain, chronic lower back pain. So, Dr. Mainiero, could you please give us some brief ideas about what you do and your specialization?
Okay. Good morning, Patrick. It's so nice to be here. I'm a chiropractor. I live in Vineland, New Jersey. I've been in practice 26 years. My specialties are biomechanics, rehabilitation, and problem cases. So I really enjoy working with my clients, other doctors' clients when they run into a problem.
Right.
We like to work with the hard cases. We don't Easy cases are fun, but hard cases are even more fun for us.
Right. You are the go-to doctor when the case becomes hard.
Yes.
Right.
We get a lot of calls.
Yeah. So what was your personal story when you decided that you wanted to, I guess what made you to decide to devote your life to this, this profession?
Well, it wasn't a life-changing event. It was kind of a directional event.
Yeah.
I was in marketing and finance, and I was taking the accounting track, and I was bored. And I went with my brother, who was a scuba diver, to a chiropractor who was working on his back.
Right.
And I hit it off with the friend of his who was a chiropractor. And next thing I know, he says, John, he said, I really want you to be a chiropractor. And next thing I know, I changed course and I was taking credits towards going down to medical school. Took me about a year to get some of those credits that I needed. And like most chiropractors that mentor other people, I do the same now for people also. When I see them needing something more in their career path, I usually nudge them towards chiropractic, and a lot of them have changed. So over the years, I have close to 20 plus people that are practicing now because I said, hey, I think you'll be better off as a chiropractor. You have a better personality for this than you do for the other thing you were looking at.
Wow, you are really changing the world. So most of our audience have the chronic lower back pain. So I know everybody knows what is chronic, what is the lower back pain, but what is a definition from your perspective about the chronic lower back pain, especially from the biomechanics?
Yeah, chronic low back pain. There's two ways chronic low back pain can present. One, it's an injury, which is long term, and if you can't change the biomechanics after that, you're working with what you have left over. So there's kind of a deficit there. And the other one is caused by sustained postures and repetitive movements. That's the one where I like to listen to the patient instead of me telling the patient all the time, come back. If I listen to the patient, I usually can, after a few visits, figure out exactly what they're doing, because they'll volunteer it and say, it's that one thing I keep doing. And I always tell them, I said, it's as simple as you doing the same thing over and over, day in and day out, that's causing this. So we make one little change in the way they do things, or we remove one thing that they're doing or adapt it. Like we use any of your products. I usually tell people, try this one product, and they take it home, and it's life-changing for them. So I always like to isolate that one little factor, I call it, that changes that situation.
So what are the key drivers to a chronic lower back pain? Whether it's a cause in the chronic lower back pain, or is this exacerbating, or making them kind of longer, persisting longer?
Well, a lot of it is exactly that. If it's chronic, you're doing something over and over to the chronic pain that's wrong.
Mhm.
So if you have a herniated disc or you have some type of inflammation in the spine and you're constantly loading the spine with axial compressive forces and rotational forces,
Mhm.
you're going to have an irritation of that disc material or those soft tissue components surrounding it.
Mhm.
So my practice and what I do is a lot of axial decompression.
Mhm.
Plus, we like to be able to give the patient that stands most of the day some type of support. So I work with custom arches and supports. I definitely think that fixing pronation and biomechanics of the feet are a big deal, as well as adjusting the spine. But on top of that, if they are sitting all day, I usually put them on a proprioceptive device like the back vitalizer. I usually have them do exercises standing on the back vitalizer like a wobble board. A lot of times we adjust them and do that with a recommendation, and we get the results that we want right away. It's if they follow through on what we tell them.
Mhm.
The last component is, I call that bad bed, bad back. And a lot of patients that come in, we don't even have to touch them. They'll tell me they go to bed at night feeling okay. When they wake up in the morning, they have back pain and it lingers throughout the day, or it disappears a few hours after they get up. So
Mhm.
obviously, whatever bed they're using, they're actually sleeping in sort of a dip, which is causing those spinal joints to open and stay open in that position for a length of time, which allows the disc material and the swelling to fill that little void. So
Mhm.
whether it's side sleeping or sleeping on your back, you're going to have that issue. So we always address that with one thing. We tell them, it's your bed. Sleep in another bed in your house for 1 or 2 nights, which is usually a kid's bed or a single or a double instead of a king. And when you purchase a mattress, we tell them to get a firm or extra firm, no pillow top, and stay away from any of the memory foam if you have a back problem. They're not really
You're,
a good.
you're saying you're saying we should stay away from memory foam mattresses?
Yeah, because
So,
you sleep in a memory foam. You don't sleep on a memory foam. So if you already have a weight distribution problem with your spine, when you sleep, you're instinctively going to lay on your side and your midsection is going to dip in and stay in a dip position,
mhm.
which is going to take that axial length and
Mhm.
it's going to laterally bend it
Mhm.
to an angle
Mhm.
instead of a full length.
Mhm. So this dip obviously it depends on the body weight of a person. So we have a big people, we have small people, and for the different firmness of the mattresses, how do we know which mattresses is right for us?
I tell people to do a couple things. I tell them when they go to their mattress place,
Mhm.
don't get caught up in the mattress they tell you need. Find a mattress that doesn't have a pillow top. So I want them to lay on a regular mattress to begin with.
Mhm.
If they feel like they're sinking into it slightly, they need to go slightly more firm. Most people are under the impression that a soft mattress is comfortable and a good night's sleep. You start off with a firm and you add extra firm. Titanium springs are always a must. They have better memory than regular ones do. I also tell people that if they've had a bed more than 5 years, they really should consider trading it out for a newer bed.
Mhm. So if I understand you correctly, you said that the people should test the mattress without the foam topper. Just try.
Absolutely.
Oh,
Absolutely. Yeah.
I think this is really key. Yeah.
And I always tell people also, I said, it's a lot, and they say, oh, well, I'm not sure if I'm going to like a firm mattress. I said, listen,
Mhm.
it's a lot easier to make a firm mattress softer than
Mhm.
it is
Yep.
to make a soft mattress firmer. The days of putting a board under your mattress
Right.
to make it hard, you can't do that anymore. It just don't work.
Okay. 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 Yeah. That's a great point. So to test the mattresses without the topper, make sure your body is not sinking, and then we add in the topper that just to create that cushion to sleep more comfortable. That's great.
If it's firm to begin with or extra firm, adding a half inch or a quarter inch of foam
Yeah.
isn't going to make you fall into the bed. It's just
Right.
going to give you a softer surface. But if
Mm,
you start out with a pillow top and a soft bed,
mm,
over a period of 6 months, that bed's going to dip and you're
mm.
going to have that hole you're sleeping in.
Yeah. Now, a lot of people say, well, the Tempur-Pedic mattresses, that's very expensive and that's the alternative. So what's your view about the Tempur-Pedic mattresses? It's
Well,
true.
as a chiropractor, I was asked about 15, 16 years ago to sell Tempur-Pedics through my office. So I was one of the first persons to buy a Tempur-Pedic. And I found out that after a year on a Tempur-Pedic, my back hurt worse.
Uh-huh.
So we called them up and they replaced the one I had with a newer one. I told them there was a flaw in it.
Mm,
And so I got an even firmer one. I still had the same problem. So I'm
mm,
not a big fan, and I'm not bashing Tempur-Pedic, but
mm,
it's the bane of most people's problems.
mm, mm,
Um, you want to ask me which one I prefer, and I don't sell any mattresses anymore.
mm,
But I find out that from most of my patients who use the sleep number bed, they usually are able to control the amount of firmness,
mm,
and
mm,
they don't usually have a problem. So they've come a long way in their technology.
mm.
Um, that's good, but so are the beds with the titanium springs and the firmness with no pillow top.
Mm-hmm. Okay, great. Um, So now you were talking about the importance of the posture, but I guess a lot of people, or most of us, and me included, I would say, well, my posture is pretty good. So how do we know that our posture needs to be improved?
Well, couple ones. First, like our vehicle, if we see our tires wearing, we know there's a problem with the alignment. Same thing with our shoes. We look at the telltale signs of wear on the heels of the shoes. You
Mhm,
can also look at the toes of the shoes and see if there's a lot of drag marks on them. But mostly, if you pronate or turn your feet inward when you walk, or you point your toes to the outers instead of straight ahead,
mhm,
you're going to see wear marks on the outer edges of the heels on each shoe, respectively,
mhm,
and they're going to look like somebody chiseled off a nice little area.
mhm,
And that's how you pronate. From the time you heel strike to toe off, those things are not gonna land perfectly flat like they should. So you're gonna
mhm,
come down on your heel and roll it out and burn those heels. So
mhm,
that's one of the signs. Some people have a high shoulder, low shoulder. When you look at them, some people lumber to one side when they gait forward, and you have them walk up and down the hallway. You can actually see it the way they move. Put all these together, and you have a pretty good picture to someone who has an issue either with their the stability foundation area of the pelvis, or they have an impending knee problem or a pronation issue.
mhm. So in other words, to tell whether they have a posture issue, one is they can take a look at the how their shoes are wearing. On the other hand, they should ask somebody else to look at them to see how their posture is, preferably a doctor.
Yeah, a lot of times people will come in and say, I think it's my knee that's making my back hurt, and I always agree. Well, let's look at the knee first, but you need to look at the whole chain of kinetics from the spine all the way down to the foot, and make sure everything is working correctly together. Than it is, deductively, inductively. You want to make sure that the problem is not just coming from one part, but it's the whole that's causing it.
Yeah. So now, over the years, you must have come across a lot of patients. They have went through a lot of other doctors and the hospitals, and they have this chronic back pain. It just didn't go away. But then finally, they came to you, and then you use your magic, and then the chronic back pain got under control. So, could you please share one or two of this kind of cases?
Sure. The one I like, my favorite one, is the patients that I talk to and they get well immediately before I never have to touch them. A lot of these patients over the years turned out to be patients that were taking statin drugs. They
Oh,
would come in and they would say, "Can we have a consult?" And I absolutely love to sit down and talk to a patient. I think I get more people well with the consultations than I do sometimes. Actually, I tell them I don't even need to touch you. I think I figured out what's going on.
wow.
So when you talk to these people and you ask them about their chronic leg pain and their chronic back pain and their aches and pains, I ask them, when did it start? And they usually give me a year, 2 months, 6 months. And then I ask them what medications they're taking. And usually they're on some type of statin drug, and it's usually around the same time. I say, listen, we really need to have you contact your family physician that prescribed this. See if we can get you off this for 3 months. I said, if you get off this and the pain goes away, there's your answer right there. 99% of the time, and I'll say 99% of the time, these people will come back to me and thank me that that was the issue.
So you're saying that the chronic back pain is actually the result of the medication that was intended to cure the chronic back pain?
Well, the statin drugs are for the statin drugs are for cholesterol, high cholesterol.
Oh, sorry. Okay.
But what happens with the statins is they cause all kinds of aches and pains in the body, but mainly in the low back and the legs.
Mm-hmm.
So if we can remove, like I said, one factor in a person's health, usually that's the answer. And these are one class of patients that we help without ever adjusting them or touching them. It's just we listen to them.
Right.
Doctor means teacher in Latin. Most doctors don't understand that. So they're quick to write a script and walk out the door because a pill for every ill. We don't believe that. We think that there's always an underlying cause, and that's one of them. A lot of other things, back pain. If somebody falls, obviously that's going to be a problem that can be remedied through care and rehabilitation. But then you have people that do certain jobs that require sustained postures and repetitive movements. So they don't always know when their back pain started. They just know that it developed over a year or two, period, and it got worse. So, and they go to their doctors and they get x-rays, and the x-rays don't always show anything major going on. So we have to delve into, what type of work do you do? What type of posture are you doing? Are you a tractor trailer driver? Do you sit at a desk all day? If you do, you're basically in forward flexion. So your spine is open, you're unevenly spaced while sitting on the chair. You're in a position which is causing you to either move to the left or right repetitively and unbalance your pelvis, which in turn takes that spine and puts a little bit of forward flexion and some torque to it. Do that for 10, 15 years of your life while you're sitting at a desk, you're going to have an overall problem of degeneration and an adaptation to a position that humans are not meant to be in.
So you mentioned about the flexion. Flexion is, you're talking about the body is bending forward, right? And you're talking about the spine is open. That means the spine loses its curvature.
They're all open, yes.
Okay. Yeah. So now, as a chronic low back pain patient, we often don't know when it started, how it started, what is the cause, and all of those things. I only know that I have pain. So in this kind of situation, how would you recommend me to go about? Whom should I go to see? What should I do? What should I check? And 1, 2, 3. I know there are a lot of different kinds of chronic lower back pains, but in general, where should the people start to start?
They can start at their family doctor if they don't go to a chiropractor, but they should always take an x-ray to make sure that there's no underlying pathology. In the absence of an underlying pathology, meaning a fracture or cancer or a severe degenerative process with ligament failure, you'll see in most cases that there's something going on there. Most doctors will do the general x-ray. I find that if they've had chronic pain for more than 6 weeks, if they've had a radiculopathy or a radiating component of pain that travels down into the extremities, an MRI is always warranted. That's the gold standard. I prefer the MRI over a CT scan because of the what you see is better. Then we can see if there's a soft tissue component. A lot of times there's a disc problem. There's a herniated disc, a bulging disc, an extruded disc, a fragmented disc. Some of these come from injuries. Some of them are hereditary. A lot of bulges are there in the absence of pain. When you do an MRI, they just show up incidentally. They don't cause any problems. But in most people, when we do the MRI, we can find out that there's a problem. And that's where the biomechanic changes in your life come in. You need to find out what's going on before we do any type of drastic changes in your spinal health.
Yeah. Now, a lot of people are engaged in different kind of activities and hobbies, and some of them are really hard to the back or the neck. I know that you are in your spare time, you're an expert for coin mining, and I think a lot of of our viewers, especially those living in the southern states like Florida or California, they love coin mining as well. So what are the problems with the associated with coin mining in terms of back pain or neck pain, and how should people try to prevent them or deal
So
with
you're talking like when you're talking about metal detecting with the detector, and
right.
I've talked on this extensively on a couple of our live shows. Yeah, there's a lot with it. There's a lot of guys that get into it that are not in great shape. And then there's a lot of guys that get in and are in good shape, but over time, they carry a lot of weight going forward. So the weight of the machine you're using can vary from 8 pounds to 10 pounds. Mine happens to be one of the heaviest ones, but it's the battery pack that keeps it going. I carry a 9-pound shovel over my shoulder. I carry a small backpack around my waist. I don't carry a large backpack. Some guys carry a backpack with all kinds of gear, depending if you're going into the woods and hiking.
Right.
Everything is forward flexion. You're doing that same bent over movement all day. You're getting down and you're digging holes. Some of the terrain is hard. So I always tell people, good shoes, lots of support. Try to use equipment that'll benefit you, not ones that are detrimental to your health. A lot of guys like to carry a small pickaxe, or some guys like to use a short shovel and get down on their knees. I prefer to use a longer shovel and dig upright because it doesn't hurt my back as much. But over the last few years, I came to develop a few products that will enable the person who either sits for a living, drives for a living, or does that type of hobby to counter those detrimental effects. And for me, I developed the Back to Normal brace, which is a shoulder support that holds everything into the upright position. So that's one of the things. And then lumbar supports are really good too, but a lot of them are very very restrictive in the movement.
Right.
The one I developed now is a fully functional support brace. It lays under the clothing very smoothly, not bulky. It allows for rotation and flexion without gathering or bunching up. So I'm designing devices for these purposes now. So that's what I like to tell my people.
Great. I can imagine that this kind of braces is not only good for the coin miners, but also for a lot of those field workers, whether it's construction workers or whatever those people.
Yeah, it was the shoulder brace was developed. All my patients over the years, my hairdressers, my electricians that worked overhead, anybody that worked in construction or on an assembly line, they were in that bent over, sustained posture, repetitive movements, or they were standing upright with their hands over their head. The problem I saw was that when the arms and hands came together over their head or forward, it closed down on the neurovascular bundle of the neck, the thoracic outlet. And what happened over time was it started to close that down and causing numbness and tingling in the hands. So the brace has an elastic pull that pulls the shoulders back and the neck and neck back, which takes that pressure off. So if you go forward, it's going to pull you backwards instinctively when you're done doing the movement, instead of having you stay in that forward posture, which most do.
Great. So if the viewers are interested in your magical equipment or the solutions, where can they find them?
Yeah, they can look. Did you ask where they could find it?
Yeah. Did you have a website or whatever?
Yes, they can go to my website. It's on the World Wide Web. The word back,
Uh,
the number 2,
back
the
to,
word normal.com, brace.com, back to normalbrace.com.
okay, great, great. Okay, wonderful. Thank you. Now, last question. So, what can people do? People with chronic lower back pain, what can they do at home to kind of, manage or relieve or prevent or, lower back pain?
I always say ice first. I like to use ice. Ice will bring down inflammation. Heat will actually increase inflammation inside the discs.
Mhm.
Heat on muscle is different than heat on disc. A lot of people associate back pain with a muscle pull. 99% of the time, it's not a muscle pull. It's an inflammatory process between the joints when you torque the disc or the facets. So I would prefer to use the ice over the heat. When you're sleeping at night, with lower back pain, I
Mhm.
prefer you lay on your back with a pillow behind your knees, so
Mhm.
you take some of the pressure off of the spine.
Mhm.
I prefer you lay on your side with a pillow between your knees to keep
Mhm.
you from twisting the pelvis. Those are the things I do for that. The neck, it's a little bit harder because you're constantly turning your head. So ice would be fine for the neck, and those are the things you really want to take into account.
Okay, great. Yeah, thank you for all these the tips and sharing. What else, is there anything else you would like to share with us?
Um, well, most people don't know that our friendship goes back probably about 15, 16 years.
Right, right, right. Yeah,
I
we've
met
been working
Patrick.
together for 15 years. Yeah, 15.
Yeah, we met, both of us. We were working on we were working at seminars, and I saw that he had the most wonderful product I've ever seen. I was intrigued by it, and I tried his products out, and to this day, I'm still a #1 fan of the products. And he actually inspired me. You actually inspired me to develop my own products. So here I
Oh,
am today,
thank you.
thanks to you.
Oh, no, it's very kind of you. Yeah, thank you for your your trust and friendship and support over the years. So really, this 15 years is a long time, right? Yeah, we don't have many 15 years in our lives. So really,
No, no, yeah.
really appreciate your friendship and the support. Yeah, thank you, Dr. Mainiero, for your sharing and your advice and for your tips. I hope that our audiences will, put these tips into practice to get better. Thank you. Take care.
Thank you for having me.
Thank you. Bye bye.
Have a good day. Bye bye now.